The most common, like I said, we really usually are not able to do surgery if there is what we call an exophytic part of the tumor, which is kind of growing out. It's like inside the brainstem or inside the thalamus, but it's growing out into another area. We might be able to debulk it. So usually we start with a biopsy of some sort, occasionally, very occasionally, with some debulking surgery, most of the time not. Radiation is probably the most standard best therapy that we have for it. Chemotherapy has been shown in a couple of small studies to be helpful and useful as well. There's no set standard chemotherapy for this tumor. Usually temozolomide is used. It's fairly well tolerated. These tumors do respond to it, not necessarily robustly, but it does have some effect in some patients. Radiation usually lasts for about 5 to 6 weeks. It's kind of given every day, Monday through Friday. Radiotherapy and sometimes chemotherapy can slow the growth of these tumors, try to maintain function, sometimes even improve function if there's a really good initial response. Unfortunately, these tumors like to grow back again. They're kind of wired. Their nature is to start growing again. There's a new drug that was just FDA approved recently called ONC201. That was what we called it when we were doing clinical trials. Its chemical name is dordaviprone, which is a mouthful. So most people just say ONC201. It was given expedited FDA approval, which basically means that there were small but not definitive trials. There was a small trial that showed distinct responses, enough for sort of expedited fast track approval from the FDA. So that's not a guarantee that that will remain in place when more studies are done, but it's very promising. The one study that led to that expedited approval was promising. It is approved for patients who have progression of disease after standard treatments. If I remember correctly, there was a little over like 11 or 12 patients in this study. I think 3 of them had partial responses. And the way that we define a partial response is like 25 to 50% of shrinkage. And I think it was 8 patients that had minor responses is 25 to 50%. So 3 patients had minor responses to the therapy, which is 25 to 50% of shrinkage, and 8 had partial responses, which is up to 50, a little more than 50%. Were no complete responses. Considering how aggressive these tumors are and how, I mean, there was really little to no responses to other therapies. Once somebody failed standard chemotherapy with temozolomide, sometimes if they had a lot of bulky mass to them, we could use bevacizumab or, there were other agents. But once our standard agents we were done with them, there was really nothing left to give. So all of the patients in that trial had already been treated with all those other therapies. That's pretty promising to have that many patients have responses. Now, there's a newer agent that is an analog of ONC201 called ONC206 that's also currently in trial. There are other clinical trials that are being done currently. Yeah, I think what's really exciting is there's this newer analog of ONC201. I mean, ONC201 is still being tested and used, and hopefully that will be really useful in patients with this disease. But and it's what we call CNS penetrant, which is really important. A lot of the newer immunotherapies and things, they're hard to get into the brain. They're big molecules. ONC201, it is CNS penetrant. There's a newer analog, ONC206, that is just starting to be tested. There are some checkpoint inhibitors and immune modulating drugs that are currently in clinical trial. Other immunotherapies, vaccines, monoclonal antibodies. CAR T therapy is being tested currently in this tumor type. What that is, for those who don't know, basically their T cells are a type of white cell that can fight cancer cells. And you have them in your body. We all have T cells, but they're just not enough of them, and they're not focused enough to really keep up with cancers. This is a very simplified explanation of CAR T therapy, which is pretty complicated, but basically we take T cells out of a patient's blood, and in the lab, an antigen gets put on them called CAR, and then those cells are grown so that you can get a lot more of them. These are sort of like amplified cancer fighting T cells, and then they're given back to the patient. So that is, a pretty novel approach that is being tested currently in this patient population.